Hello and welcome back. More good news. Prince Charles is out of virus self-isolation. That's good news. He hasn't died. That would be treasonous to suggest otherwise, of course. But the particularly good thing about this is, of course, seeing as he is 71 years old and has spent 7 days self-isolating, that he's now been let out, saying that yes, he's recovered, and despite being a septuagenarian. So it does suggest that it isn't necessarily a death sentence for old people, and as I covered in my last video, that it's no longer a highly consequential infectious disease. It does seem like these quarantine restrictions aren't as necessary as we first thought. Of course, they are there to help the older people, and Prince Charles isn't the normal old guy, of course, seeing as he is a lizard. But seeing as, of course, he's going to have good medical care to take care of him, no doubt about it, and therefore the concerns that he would have spread it to his mother, who's over 90, of course, our reigning monarch, Queen Elizabeth II, that she would also be suffering, but of course is self-isolating as well, along with Prince Philip, in order to try and keep them going, although, as we all know, they are clearly immortal. So the Duchess of Cornwall, 72, was tested and did not have the virus, but will self-isolate until the end of the week. The idea, hopefully the plan will be that if you can get as many people as possible to have the mild form, the S strain, if you will, of the virus, and therefore just have these mild symptoms, then of course they will be protected against the L strain, the lethal strain, and therefore they won't have to be concerned about quarantining because they can come into contact with whoever and not have to worry about it. The same goes with what we've seen with the Red Bull F1 team leader, saying that yes, he kind of hoped that his drivers would get coronavirus early on so that it wouldn't happen during the races. It's the same kind of idea. Similarly with NHS staff, of course, that if they contract it sooner rather than later, then they don't have to worry about getting it from the people that they are treating. And at that point, they wouldn't be passing it on to anybody else either. So that's all well and good. We are also increasing our testing to see how many people have already contracted the disease. Of course, we are trying to put the test forward to NHS staff, the frontline workers primarily, instead of randomized testing, similar to they did in Iceland, of which they found that quite a few people had it who didn't realize that they had it, and that's why their mortality rate is quite a bit lower, because they're testing everybody, not just people who have the more severe symptoms. In fact, they can test people who are asymptomatic. Hence, it looks much better from a Icelandic perspective. The tests themselves are ramping up, of course. The idea is to be able to have 25,000 a day. We had 6,000 this gone Sunday, so yesterday, hoping to get to 10,000 as soon as possible, and then moving up to 25,000 tests. Obviously, if you're tested and you don't have it and you haven't had it, that doesn't mean you won't get it, of course. It seems that you will then have to be tested on later. But some companies have decided to take it into their own hands, as we've seen Ocado. They've bought 100,000 tests for their staff at a cost of £1.4 million, putting it at about £14 each per test. So should the supply be there, that is how much you could pay if you were to get it done privately. Not that you're allowed to with the NHS having such a stalwart control over your health, but nonetheless. So with that in mind, that the old guy, good old Charles, is doing well, he's recovered and hasn't gone on to Liz or Phil yet, we have the other developments. Seeing as we are worried about quarantine and the social distancing of 6 foot or 2 meters, some countries have taken to letting out prisoners. Northern Ireland has decided to join in that in the UK. Up to 200 inmates nearing the end of their sentences will be let out. The Scottish Government is considering similar measures, while in England and Wales a range of options, including early release and the transfer of prisoners to other sites, is being explored, in which case you would just have one which is prison/hospital, of course. So it's basically just a hospital for prisoners, in which case you can send them all there, because if the prisoners are self-isolating nonetheless. So now it just comes down to the visits that they get and how you want that to be done, and if it's done with a glass barrier between to phone through, if you will, so we don't have the human contact, as difficult as that is for the prisoners, of course. Hopefully they will understand that in this instance it is for their best interest and it isn't just trying to have cruel or unnecessary punishment against them. So that is definitely one way to act as a precaution there. 2 repatriation flights rescuing British nationals who are stranded in Peru have landed at Heathrow Airport, so that's why the airport is still open for commercial flights, is in order to get British nationals back to us, especially in countries where they don't want them. Like the gentleman in South Korea who didn't quarantine himself for 14 days when he first went, but instead went through 5 different cities and was then tested positive. South Korea obviously isn't taking kindly to that British national and would like him sent back as soon as possible, of course, as you would expect. But another good news, a breathing aid that can help keep coronavirus patients out of intensive care has been created in under a week by University College London engineers working alongside clinicians and Mercedes Formula One. Obviously, the Formula One, as Bill Burr says, is the sport for the Illuminati. It's why they just plough in ruthless amounts of money, and why Monaco is such a haven for them, of course. And we've seen that similarly for ventilators, that we've got splitting respirators, and I think the best one for the respirator splitting was done by splitting 1 into 9, which was done by one doctor. And of course, if you can do that, then you can very quickly shrink the amount that you need or maximize the ones that you have. Not to say we don't have them in storage waiting, of course. We've seen with Cuomo in New York, he had about 4,000 in storage waiting because we're not expecting it to hit its peak yet, apparently. Although New York, it seems to be the worst affected in America. Draw your own conclusions there. We've got police out and about issuing fines to people. So in Scotland, they issued 25 fines over the weekend, just the weekend, to people breaking the coronavirus restrictions, such as businesses that were still open. The force also said it received a significant number, this is great Stasi work here, of calls including from people reporting others who were breaking rules. So yes, this is just, hi police, I see somebody outside. It's like, brilliant, let's go find them. It's very Orwellian, if you will, or relating back to a particular period in history which YouTube doesn't like us mentioning, but as children were told to tell on their parents, it's that kind of thing. Obviously you could say this is slightly different, seeing as it's trying to keep everybody healthy, but you could just say, well, okay, if you see people out and you're quarantining and self-isolating anyway, then you don't have to come into contact with them. That's fine. We have enough CCTV cameras around anyway for them to be caught, I'm sure, and tracking the phone that they want to do officially instead of just having to do unofficially at the moment. So airline EasyJet has grounded its entire fleet of aircraft due to the pandemic. However, thousands of EasyJet and Virgin staff are being offered work in the new NHS Nightingale Hospital, which is being set up at the ExCeL Centre in East London, and around 100 cabin crew have expressed an interest. So if they're going from that hospitality side of taking care of people, and they do have some medical training, of course, because most of the pay that they get is not for their day-to-day work. It is for being professionals in being able to deal with medical emergencies on board the aircraft and other emergencies that could happen. That is where most of their pay comes. It's danger pay, basically. It's precautionary financial support. The UK's main internet providers have agreed to remove data caps on fixed-line broadband during the coronavirus pandemic. Good if it works, but given that we're already seeing some that are kind of closing down, as in they're not being able to keep up with the demand. We'll have to see how that pans out, but it's a nice gesture nonetheless. A rapid response unit within the Cabinet Office is working with social media firms to remove misinformation about coronavirus, and we will know how that goes about trying to remove fake news. Convenience stores selling Easter eggs are facing interference from heavy-handed officials suggesting chocolate eggs are not essential, a trade body says. Yeah, so the police, some of them are going far too far, of course. You've got drones filming people out walking their dogs in the countryside because you can only go once per day. It's like, well, good luck with a dog. But nonetheless, are these people in the countryside really the ones that you're concerned about spreading the disease? No, of course not. It just seems like almost as if they're on commission. How many people can we capture and fine in the shortest amount of time possible? It seems that they are going a bit above and beyond the call of duty, and not in a way to protect us, but in a way just to finance and make our lives more difficult. So the same goes here of, but what counts as essential? It's like, can you leave me alone, please? Thanks. And then in South Korea, as I say, they deport a British man in his 30s. Meanwhile, Mr. Johnson said the public appeared to be obeying the restrictions set out by government to slow the spread of the virus, adding that train use was down 95% and bus use down 75%, which is obviously phenomenal, jolly good. Not using public transport. I mean, Greta must be having a field day. But unfortunately, because we have reduced the amount of people using the transport and Sadiq Khan has decided to lower the amount of trains running on the tube services, then people are packed in just as tightly as they were before, not being able to obey the social distancing in London. And of course, that is the multicultural capital hub, and therefore is most affected by people moving in and about freely the most often. So that is where it is most important to try and protect people, because that is where they are most at risk as well. But all in all, it seems to be pretty good. We don't know how many people have the virus, as we're trying to decide how fatal it is, and from there you can extrapolate out to how many people have it, by how long it's been about and how early the first cases were and how infectious it is. Then you can kind of decide. But seeing as we don't have any accurate figures for this information, we can't draw any accurate conclusions or results of how many people have the infection at the moment. So it basically just comes down to stay safe, stay healthy. There doesn't seem to be a plan to ban alcohol at the moment, despite I think it's in Greenland and France, in areas, capital of Greenland, and in an area in northern France, they've banned the sale of alcohol. They say it's primarily to stop domestic violence, that people are in too much and they're drinking and therefore hitting each other. Not each other, of course, they're focused about men hitting women. Let's not go into details about it being a 50-50 split and women are more likely to use weapons. But anyway, that is their concern. Therefore, they've banned the sale of alcohol. Johnson doesn't seem to have any intention to do that, seeing as they said essential includes off licenses and distilleries that sell through their distilleries as well, and even pubs selling out, and the online subscription services, that they're still up and running. So it doesn't seem like that's going to be an issue, but I know that's been floating about, so I thought I should address it. But otherwise, all in all, it seems to be in hand. We're actually doing okay. So well done, everyone. Keep doing what you're doing. Keep up the good work. And until next time, have a good one.